Goldie Hawn, plastic surgery gone wrong? Well, keep in mind she's in her 70s. She's had likely procedures for a long time now, but I'm going to look at some pictures of her today with you. I'm going to point out some of the aging features, what may have been done. Most importantly to us, how can you avoid this look? And what does that mean? I don't know exactly what she's had done, but I'm surmising from the pictures, some things are more obvious than others. It's likely that you can tell something's been done. It's not natural. Now, to know what natural is, we'd have to see her with nothing ever done from start to finish. And very rarely do we get to study that. Let's look at her pictures, see what we can ascertain. But what people don't like about some of the plastic surgery they see is that it's obvious to them. Let's see what's obvious. We have to start here. This is the starting point. If we look at this picture, what I want to show you is that she started with a narrower face. From when we're babies, we have a compact face, a lot of cartilage, the bone opens up, it grows. You have a nice narrow face. There's no fat down here, and that's what gets so many people, the lower face fat. Nice volume in the lips, beautiful nose to start with, wide open female eye. Now, if we fast forward to what people might not like, I want to go to this picture because you can see some changes on the left. You're starting to see some jowling. What we call the concertina effect, the face becomes more compact. Understand bone. So it's hard to get on top of the bone loss, but here's an old bone versus new bone. You see what we're fighting with our treatments, and I'm going to tell you what you can do to help prevent this, but you see some early signs of aging on the left. Let's go to the right. This is where people would say maybe too much was done. What are we seeing? The eyes aren't as wide open. Why? The anterior part of the cheek was filled. So if we look there, we don't know what it was. I don't know what it was, but it could be fat. Fat, hard to reverse. Fillers, hyaluronic acids, you can reverse. A lot of biostimulars go away. Things like Bellafill don't, PMMA. So it's likely fat or hyaluronic acid fillers. Hyaluronic acid fillers draw water in. That's why I say you always have to be careful in the front of the face. Why do people want it filled? They want to know they got their money's worth, go home, look in the mirror. Oh, here's my filler, great. But people around them, like this, would think it's a little unnatural. I want to point to one other thing. If you look at her smile, and there's many pictures like this, it's crooked. So people, after having a facelift done, a lot of times fat's changed, skin is pulled tight. The tighter it is, the more the mouth looks funky. There's also nerves that can be damaged. So one of the nerves, actually, when you smile, pulls down the mouth so we smile normally. You see the difference in smile in these two pictures. On the left, perfect, upper teeth showing. If you want to know what the perfect smile is that the dentist will look for, I have a whole video on the smile, teeth show, gummy smile, etc. But if we look on her picture more recently, you see the smiles change. There's an irregularity. Asymmetries do get worse as we age, but this could be the result of surgery. If we look at the next picture, I want to show you here that effect of the face shortening, and she didn't have a long face to begin with. So as a practitioner, every face is different. We're looking at them differently, recommending different treatments. That's why it's impossible for me to say in this channel when people come, hey, what should I do? You have to look at the face. Is it longer? Do we need more volume? Is it short and compact? And that's going to get you with the lower face. Look here. If you look at the lower face, her masseter's wide. She's straight up and down, meaning she has a square jaw, compact face. That's a masculine look. Sometimes a hard thing for us to correct with surgical or non-surgical procedures. Good lip volume. But if we fast forward to this picture, very important to look. What was missed here in the overall, and missed meaning, I can't say it was missed, but what would I have recommend to her more than anything is to maintain her collagen. And how you know, what's the clue here, do you think, that something happened that killed the collagen? Look at the décolleté. Look at the sun damage on the décolleté, and that shows you there are pictures that show the face much less sun damage than the chest. The chest is often the giveaway. People have had sun on the chest, they've had it on the face. That's a collagen killer. But if you look around here, I'm gonna blow this up a little bit. Look around the mouth, the chin, the eyes, there's collagen loss. This is often because people don't do fractionated RF, CO2 lasers. They don't take care of the skin. By doing multiple surgeries or facelifts, a lot of times, I tell people all the time in this channel, they don't pay attention to the skin. Surgery doesn't make the skin better. It removes the skin that's excess, and the SMAS, or that muscular layer that's very important in the face, superficial muscular aponeurotic system, is repositioned to tighten, and that is what leads to that funkiness around the mouth. Let's look at her lips, because lip filler is very common. Look how much volume she had here as opposed to when she was youthful here. And she has the same amount of volume, pretty much, wider mouth, but of course, lip volume decreases from the age of 23. We know something was done in the lips. And newer lips surrounded by older skin always looks bad. One final thing to point out, look at the distance from the top lip to the nose. That ergotrid, or why people get a lip lift, with those bony changes that I showed you, the distance often increases. The face becomes compact, but that piriform aperture, or the hole in the skull in the center, widens. With that, you get the lengthening of the skin look above the lip. Often that's why people do lip fillers, to shorten that distance without taking care of the skin. One of the takeaways from this is mind your collagen. Diet, healthy diet, organic foods, exercise, doing your monthly and every 3-month treatments like I advocate on this channel, so that the face is congruent. And for bone, not a lot you can do for exercising the face, but your bone loss measures, including my video you can watch on the one vitamin deficiency that may be aging or wrinkling your skin, and that is vitamin K2. Goldie Hawn, icon, in her 70s. What do you think she's had done? Stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.